Hey, everybody. Thank you for being here today. I am Liz Lundry, longtime hygienist since 1979, and I have been a trainer with the JP Institute, and that I've been doing for over the last 30 years. And I'm excited to talk about the courses that we're going to be offering at the Colorado Surgical Institute today. So, having gone into offices, hundreds of them over the last 3 decades, we're able to really help elevate the level of care for our patients and also get the entire team on the same page and also able to have a huge impact on business growth. So that's what we do in a nutshell. We'll be talking more about it. I'd like to introduce my colleague and good friend, Annie Harris. Annie, tell us a bit about yourself.
Hello, thank you. I have been practicing dental hygiene since 1996, and I early on in my career jumped straight into perio. It was my passion, it just clicked. And so, whether it was in a specialty periodontist office or when I was with my general practices, I would see 80% of the periodontally involved patients. Um, and that's what I prefer. That's what I love. When the term biofilm became a catch-all, I went super deep in the research. I probably geek out quite a bit when we start the conversation of biofilm because hygienists, we don't always really know what we're looking at, and doctors too. And so I think a huge part of helping my patients and vice versa when we train is to help the clinician visualize that biofilm. And once we understand all of its little idiosyncrasies and how it can be just, a misbehavior once that implant gets in the mouth, it makes sense. Localized periodontal treatment is not what we do. It's the whole mouth, obviously, the whole body, it's the whole microbiome. And I think that's the biggest paradigm shift that one for my patients, like, and Liz, yeah, you can of course completely understand, and you guys too. Once the patient understands that it's not just, oh, let me fix this one tooth with this one pocket, this swollen gum, um, it's eye-opening for them. And a lot of times, and sorry, I'm probably babbling, but a lot of times the patient chooses the treatment, before the doctors even had a chance to really understand, the philosophy, because the patient understands what's in their mouth and they want it better. So yeah, I'm your biofilm girl.
Yes, we love that. Thank you so much, Annie. It's everything that we do at the JPSU is science-based. It always has been. And that's why it's evolutionary hygiene, because as time goes by, there's more research, there's different technologies we have for maintenance. And with more and more implants being placed, we really need to make sure that the entire team understands how to maintain them. But initially, we want to make sure our patients get those implants. So we really help with the verbiage necessary and the team working together. So your patients will accept restorative therapy, especially, with the implants, as well as periodontal therapy, which we've always done as well. So it's a matter of putting that together because it is about that oral systemic link. So yeah, we're really excited about sharing that with everybody.
And then do you want to introduce me real quick and we'll do a quick edit
Sure,
or,
sure.
okay.
Mhm.
And
And
then
so we
Annie, is it possible to stabilize your camera at all?
Fine, fine.
Possibly.
Yes. Let me go get my little lap thing. Hold on.
Thank you. Sorry.
That's okay.
It's a good call. We've got some image stabilization that we can apply, but this would be a lot easier.
And then, yeah, if you want to just give me a nod in and then I'll kind of, do a quick little something and we'll see where it goes.
I'll introduce you as the founder
Okay.
of the Colorado Surgical Institute and how I had the opportunity to be there and see you in action. So
Yeah, and I was really appreciative that you guys made the trip out to see us and just to come and hang out with us. I know you guys are you're very busy, and for you to just even make that
it
make it
was,
out to see
Very.
it, it was much appreciated.
we were happy to be there. It was really cool. You have a great setup there, and just the energy and everyone's enthusiasm. We really enjoyed being there. So yeah. All
Yeah,
right.
thanks, Annie. Sorry.
Oh, no problem.
Okay. So I would like to welcome and introduce Dr. Taher Dhoon, who is the founder of the Colorado Surgical Institute. And I had an opportunity to visit during one of the courses, and it was an amazing experience as an instructor. And everybody who was speaking was so engaging, and I learned a lot. And just the atmosphere and the energy that was there, everybody was so excited. So it's a great place. You've created an amazing venue there for helping doctors. So thanks, Dr. Dune.
Well, thank you so much for the kind introduction. And a little bit about myself, you know, I'm the co-founder of Colorado Surgical, and we've been teaching live patient courses for close to 5 years now. And we've been teaching dentist surgery for about 8 years now, but then we formalized it with our own company in Colorado. And one thing I've always said from behind the podium is that this was like the triangle offense with the Bulls in the 90s or the Lakers in the 2000s, where it was predicated on your financial team being able to close surgical cases and implants, you as the doctor having the clinical skill set to do it, and then your support team being able to support you. And I'm a little embarrassed to say I didn't have the foresight to actually think of an analogy that included hygiene in it. And what I found out over the years of having now probably thousands of patients in the practice that have dental implants is I had to restructure my entire hygiene program. We had to buy new technology. We had to figure out ways to help patients and catch it early. So then we weren't having repair cases. If anything, it was just like mucositis and periodontitis, and we weren't allowing it to have like move into bone loss. But I had to learn the hard way by having hard conversations with my patients and and then revamping my systems in a way to not let them fall through the cracks. And that's why I'm really happy to have you both here and to be part of Colorado Surgical and bring your program and knowledge to the attendees that come to our courses because it's such a critical thing. And I've said this before to you guys, I've said from behind the podium, at this point in my career, I can do a good surgery. And I'm pretty confident about that. But when you see patients come back in post-operatively and there's just the home care and the instructions and the program after the fact for long-term success, if that's not dialed in, I mean, it'll degrade and break down. And then there's headaches and hard conversations and lost stomach lining. And so that's why I'm so appreciative for you guys bringing your expertise to our doctors, because it's so critical.
Yeah, we're happy to do that. And it really does take that team. So that's why when we do our trainings, we go in office because we do customized training in office and workshops. But it's really important for the whole team to be involved because patients ask everybody questions. And with having the hygienists really, because honestly, as you know, the patients see the hygienists more often than they see the doctors throughout the year. And so we have a great opportunity to continually educate them, but also really take the lead on helping to get them to accept treatment because of that relationship that we have and all the time that we spend in their mouths and see them so frequently. So we are in a fabulous position to do that, as well as um, look at what's happening in their mouth and really provide early detection of different types of conditions, disorders with the body, not just with the mouth, because we see changes as people go through stress. Talking about the total body health, which is key factor. And when you want them to heal, as you do an implant or any other surgery, and then there's the maintenance, it's really important that all those elements are in place. So yeah,
Yeah. I'd
proud.
like to pull on a thread you said there about, you know, treatment acceptance done in hygiene. And I think that's very applicable to surgery as well. So, you know, through your program, I know, I mean, it's a very, you know, nutrient dense program, but from a high level perspective, could you kind of share with us like some of the things you'll cover with the hygienist and the whole team as a whole in terms of how that case acceptance happens before the doc ever enters into the operatory?
Yeah, absolutely. So when we are going to actually, whenever we do any training, as we do also at the Colorado Surgical Institute, it's really about getting everybody to follow a format. We restructure the hygiene appointment, and it actually makes it less stressful and more enjoyable for all the clinicians. But the patient has a different experience because there is a part where we are actually doing case presentation. And in that format, the hygienists, the way that we orchestrate that is that they actually always talk about restorative first. And then they talk about treating active periodontal disease, which so many people have bleeding gums. So everybody needs something because we want them to be totally healthy. And we put those elements together based on patients' risk factors. So this is what we'll be presenting at all of our courses so that everybody has that skill set. And then the hygienists have this conversation with the patient, again, relating their restorative needs, i.e. the implants, with their overall health and their other risk factors and how it's linked with their periodontal health. So when we put that together and the patients understand that, they generally want to get these treatments done. You know, this is what we have found historically over the last 30 plus years of using this format. And Annie, I know you've seen that in, the offices we've worked with as well as in where we've worked, right?
Right. Yes, very much so.
Yeah, yeah.
And one other thing I'm happy about and excited about a lot of things we're going to do with the program, but a few things that really stand out in terms of conversations I've had with dentists. Um, After they come to Colorado Surgical, we of course talk clinical, but then they get enough patients in the system, they start talking about hygiene and coding and billing, equipment to use, different types of powders, whether it's glycine powder, what type of like micrometers. Are you going to touch base in terms of those types of supplies and equipment that maybe they should look into or consider to help their implant patient base or their surgical patient base as well?
Yeah, we absolutely are because we need to have that technology available. Um, Looking at the science, and Annie is a biofilm expert, we understand that we need to do more than what we've traditionally done to maintain the integrity of these implants and the patient's overall health. So we will be talking about different technologies. We try to support each office with what they have available to them, but also let them know what the best technology would be to also integrate into their practice. So we provide hands-on training with advanced ultrasonics, as well as subgingival air polishers. So we will be going over all of that and also what the patients need to do at home. Because so many of them are given instructions that, for example, what type of floss to use around them. And if they're not using the right things, they can actually cause beautiful traps for biofilm to grow. So I think Annie, we were having a conversation. You mentioned about how the biofilm, like the implant, can be like a magnet for the biofilm. Can you talk a little bit about that, please?
Yeah, the way we, explain it to students or our patients is once that implant goes in, the biofilm from the rest of the mouth it it's like, oh, let's move out west. There's all this land here. Let's head over to number three implant, and they make a home there right away. And so they're very vulnerable to the adhesion of those pathogens right away. Um, and so, I don't think we always understand that from the hygienist perspective.
Yeah. And as we are seeing more, technology, we also will be talking about saliva testing because without testing, you don't know what you're working with. And as we're treating a biofilm infection, which is what periodontal disease is, we need to know if we've been successful, and we need to also do our best to preserve that natural and best balanced oral microbiome. And that includes using probiotics and using the right disinfectant rinses that are not going to cause a dysbiosis. And we don't want to use chemicals that are going to corrode the implant and, cause other issues and toxicity. So these are some of the things we will be going over in our courses.
Awesome. And we were talking on the pre-call about how I used to handle hygiene CE in my private practice, where, and again, this is short-sighted from a younger version of myself, just letting my hygienist come to me and say, hey, this is what we want to take. And then, of course, if it looked like the numbers washed out and I could afford the travel and hotels and the course and all the things, that I'd say, okay, yeah, great, let's go do that and let's implement and, set expectations and benchmarks and things like that. But then you said something really interesting about, how really this is a whole team approach. Could you kind of share with everyone, your feedback on that one, where this is not necessarily just dependent on the hygienist to bring these courses to their doctors?
Right. And I really want to acknowledge you for listening to your hygienists and looking at their suggestions and doing the research and giving everybody that opportunity to learn. So, with this type of an implementation, with this very comprehensive protocol, what we find is that, of course, we're going to see better clinical results. I mean, we're here so that we can help our patients improve their lives, live longer, live healthier. And that's our prime directive, if you will. But we also need the profitability there so that we can do that. So we can, take more courses, so we can purchase the implants and the technology to maintain them. So with our protocol, because we have everybody on the team involved with that, and we discuss, cost of things, for example, with the patient in the operatories, it really helps the patient acceptance go way up. And this is where the hygienist will take that lead, since they do see the patients have more time with them than the doctors often do, especially patients of record that been seeing for years, maybe. And we give them the skill set of how to introduce the fact that we're doing things differently because of the research. And with that, we're just seeing that we see more case acceptance, and that really has an impact on the practice growth as profitability goes up in hygiene as well as in a restorative. So we're able again put those pieces together, and these are the outcomes that we always see when we work with these practices.
So you're saying that the hygienists that come through your program eventually at some point through coaching will start to present treatment, even restorative and all of that, and go over costs with the patients?
They do that immediately. So
Wow.
it's not because we tell them how to do it. I mean, we don't want anybody to become a robot, but we have certain key phrases that make things a lot easier for patients to understand. I mean, all of us have so much information and we want to tell them about everything. And we need to understand that some people, when we start giving them too much information, we lose them. So this has
Mhm.
been distilled down through looking at psychology, looking at personality styles, how we need to communicate with each patient as an individual so they get the right information and, find what is most important to them, having that dialogue with them too, to have them really understand the benefits of it for their health, not just for that tooth, not just that implant, but how it's going to improve their lives. And so we get more yeses, and the hygienists are trained about how to talk about restorative with the patients. Again, talking about the biofilm, the infection that they have in their mouth. So we change our verbiage to have a greater impact on the patients when we're talking to them. And this makes all the difference. So they're ready to go because we practice, we role play, we do that during the training, and then they get going. And then once they start getting more and more acceptance, of course, they become more confident. So it just continues to mushroom.
Wow, that would be a godsend. And I'd be interested to see if we just A and B tested it, the doctor presenting the treatment versus hygienist. And you're spot on. I mean, they see the hygienist, in a regular, a 1110 appointment for 28 minutes, and they see the dentist for 2 minutes. Like the amount of trust that can be built in terms of the case presentation from the hygienist versus the doctor could be significant. And if you present, let's say it's $10 million of dentistry a year, and you increase your case acceptance by 1%, I mean, that's still what, an extra $100,000 in increased revenue that comes to the practice just by by one addition alone. And that could be powerful. And that's only 1%. And I would argue it'd probably be higher than that.
Totally. And in
Totally.
what you were saying, I'm sorry, just to clarify one point, when you're talking about the hygienist presenting the cases to the patients, part of that hygiene appointment includes the doctor hygiene exam. So the doctor is involved. And again, the verbiage and the skill set that we teach, the doctor can use in their end of the practice independently of the hygienist. But when we're with the hygienist, the doctor is also part of that. The case presentation's already done. The doctor comes in, it's a slam dunk. The hygienist knows if the patient wants to have the therapy or not, have the restorative or not, because we've all worked that into that case presentation so that conversation happens. So the doctor doesn't have to go and play and go fish. But that's where
Mhm.
the entire team needs to be together so the doctor has these verbal skills and how they interact when that exam actually happens to, kind of solidify that acceptance. So, Annie, I know you're going to add something to that. Please go ahead.
Well, I was recalling the fact that out of all the offices we train, and when you bring the whole team together, one thing, it's almost every single time the administration staff is always, when we do the first part of the 2 day workshop, we start out with the science, the oral systemic health, and all the research studies, showing the connections. And you've got some hygienists that are like, arms crossed, slightly skeptical, but almost every time, and Liz, I know you know what I mean, the administration staff, they are eating it up. It makes so much sense because they got into dentistry to help people too. I mean, yes, they might be on the business end of things, but when they are empowered with that information of the science, well, the backup support is going to come way more easily once they understand the whys
Right,
of, why do these patients need to do it?
right.
Not to make extra work for them, but
Oh, it's actually less work because the patient's ready to go, and then it's just their job is
exact.
to schedule the appointment and help the patients pay for it. The patient already
Yes,
knows what's involved financially, so they don't get the deer in the headlight look when they first hear the fee from the financial coordinator. They already have
yes.
an idea. So it makes
Mhm.
their job easier too. So this is what happens in that hygiene operatory. And then, like Annie, like you're saying, I see it all the time when these administrators and the assistants understand the importance of treating this because the link with dementia, with any type of different forms of cancer, 57 diseases of the body we know linked with P. gingivalis and conditions like erectile dysfunction. As I always say, nobody wants that. Once they hear that, it's like, you know what? This is really important. Not just the perio treatment, but the restorative, because there's biofilm there getting into patients' bloodstreams. So they get this awakening of a mission. It's not just another procedure. We're really saving and improving people's lives. And so they get really excited about it. And we love that because we need them
Yeah,
to work. It's a team. That's what we
it's a
need.
team.
Yeah.
Yeah, I fully agree. And again, from an owner's perspective, and I'm putting myself in younger me versus current me, but I always used to calculate, well, I'm shutting down the practice for a day or two. I have payroll for the entire staff for a day or two. And then what I've kind of found over the years is it's really nice to get together with your team in a non-clinical setting and just kind of bond and have that like kind of stress away. But then two, all to go immersive into one topic to really dial in on something that's critical for all the reasons that you stated. And then three, it shows the hygiene department how dedicated you are to what they are actually doing and that you take it seriously. And I think as a result of that, I know there's a hygiene shortage these days, but an office that will hold sacred the hygiene department and put time and effort into growing it will retain hygienists, will attract new hygienists that are looking for the latest and greatest. Some hygienists are looking for technology. They're looking to continue their education consistently. I'd say the vast majority of them are. And so, from that perspective, you will attract the best of the best by creating the environment in which is going to attract those types of people. And so, it's just a no-brainer. Unfortunately, I wish I knew that earlier on. And now I'm just kind of getting some of the wisdom through the school of hard knocks from losing hygienists over the years because I didn't support the team as I should have. So I really like programs like yours where it's like you focus on what's so critical, but at the same time you're helping the entire team come together cohesively and stay together for many, many years.
Yeah, that's true. And I know
Yes.
it's a challenge with having and retaining hygienists these days, but through the over 3 decades that I've been teaching these courses with Jan, who was the founder of the JP Institute, uh, I get calls, emails, texts often from hygienists who've had to move to another town or state, and they contact us to say, are there any JP Institute trained offices here in Nashville where I am now? So they want to, once you do it this way, you don't want to do it any other way because it's more
Exactly.
rewarding. You get traction with people not only healing really healing to completion, but then staying in remission. So it's not like every appointment is a bloodbath, which is what my experience was before I went through this protocol. And I think Annie, we
Yes,
see that, right? So
absolutely.
it makes a huge difference to the clinicians. They love it and they want to keep doing it that way. And if you go to an office and you have this knowledge, but the rest of the team isn't on board with you, they may look at you like you have two heads when you talk about a treatment plan that is all encompassing and really allows patients the time to heal. So, and we don't even look at insurance. It's like with implants. You're not going to get any benefits for insurance, but when patients want something, they'll find a way to pay for it. So we want to get them excited. So they want to be healthy.
Yeah. And one of the last thoughts I have is specifically for the clinicians is when I was placing implants, and I've been in the same location now for close to 10 years, you start to see um, crestal bone loss. You start to see ailing implants that occur. Now, if you're hopping around to different practices every 2 years, maybe like, don't worry about this next thing I'm going to say. But if you feel like you're going to put your roots down somewhere and you're going to track your patients for a long period of time, you want to be in a program where you don't have to see patients degrading over time and have to have these hard conversations about like, well, the patient's going to say, well, I thought this is going to last 10, 15, 20 years, or sometimes they think forever if I haven't done my job appropriately. And then I have to say, well, no, it's your hygiene and X, Y, and Z. But if we can put into place protocols from day one, from the consultation room to really set expectations. And these days I'm recording my consultations on surgical patients. I use an app called Ploud. It's just something I click right here and it auto records and auto transcribes the conversation that we save in our software for patients. Then at that point, I can be like, hey, remember we talked about this? We talked about you coming in. We talked about all these adjuncts and products and things to help you succeed. Well, then two things are going to happen. A, you'll have a healthier patient base in your practice for however long you choose to be there. And if you're a little older and you're handing off the keys to the next young buck coming in to take over, like they'll have a successful practice and less hard conversations to have. Or two, if the patient doesn't do their part, well, you can point back to the consultation and say, hey, we did talk about this. These are things that we talked about. You did kind of not, do the things that we asked you to do. So yes, there's an additional expense to repair. And then you can feel good about charging the patient for repair and you don't have to feel guilty about it. Because for years I felt guilty about repairing cases. If the patient didn't do stuff, I did a lot of stuff for free. And this system in its place has really helped at least remove whatever burden of guilt I put on myself to want to take care of the patients in the community and then hold them accountable to the things that they said they would do as well.
That's great that you record that and you have that
Yes,
for
that's a good idea.
the and we do that. We take it on ourselves, like if a case doesn't work out, it's like it's our fault. And the patients also think, oh, it's my fault that I have gum disease because I haven't been flossing. The research doesn't hold up to that. And
Nope.
it's not their fault if they're not healing, and it's not our fault if things rebound. And with our training, the hygienists understand that. And when we talk to our patients, because we're going to see them multiple times to get them healthy, um, and then integrate the restorative into that as well, uh, they understand that they have to take responsibility as the AAP, that is the protocol, is the patient takes an active part in getting better because they have to be a partner with us. And we have to look at lifestyle. We have to look at genetics. We can test their DNA to see if they have an exaggerated inflammatory response. We can test their saliva to see what bacteria is there. We can talk to them about nutrition. We can talk to them about getting enough sleep, or their immune system is not going to be effective. So this is where the education that we can give the patients in hygiene and from the doctor as well, together, it makes a huge difference. And when you're going to be at someday selling your practice, you're going to have a very attractive package there that you're going to be able to get a good successor, who's going to carry on with that and be again profitable because you've created that already. So we really that's what we support.
Yeah, that's beautiful. Well, I'm really excited to get this program off the ground and to introduce it to, all the docs in our ecosystem and their teams as well. And I really appreciate your time and coming on and just helping educate some of the docs in the country about like what you do and what we're going to be offering at Colorado Surgical, because we've been teaching surgery for a long time, and now we're at a point where we really need to focus on teaching people how to maintain the longevity and the health for their patients in the practice after the surgery is complete. So I really do appreciate both of you.
We appreciate you, and
Thank you.
you've got an amazing institute there, and the fact that you're forward thinking and wanting to give all of this support. We're honored to have your trust, so that we can help you, fulfill the mission that we all have and share together.
Mhm.
So thank you, Dr. Dhoon. Thank you for your time as well today.